access to essential medicines, health products, and technology. What is the role of the youth? This is the fifth plenary session that we'll be having. And when you look at this as a plenary session, then the question we need to be asking, when we talk about health products, technology, and services, what are we talking about generally? First thing, health products, medicines. When you need your medicines, when you need your life wellness products, let's say for example contraceptives, where do you get them? And how do we make you be able to access them when you need them? And what is the role of the youth in driving this uptake? One of the key things that I noted is young people generally, sexual reproductive health as a component pillar, then access to contraceptives is an issue, access to wellness products is an issue, and for us to be able to access them also we have biases in terms of where we need to go seek those services, and that is why uptake at times is affected. But as young people, if you know there's a young person who is engaging with you and directing you on where you can get the products, that makes it a win. So the question is, how do we activate youthful organization in their local communities to be demand creators and drivers of uptake of these wellness products to ensure that we have a healthy and thriving population of young people? That would be a key thing for us. And then beyond that, we go to the next phase of health products and technologies as people who are able to be providers as young people. One, we can work as healthcare workers, including pharmacists. As a pharmacist, I know I have a role in delivering health products as a pharmacist. Running a pharmacy, running a community pharmacy, running a hospital setup, doing regulatory affairs work, registering medicines to be able to be in the market. That is all playing a role to ensuring we have access to essential medicines. Then health products and technologies, we also look at it from digital platforms. So many of us are running WhatsApp groups. We're engaging in people in health information dissemination. Your Twitter account, your Facebook pages, whatever information you are sharing, that information is ensuring there's access to essential health products and technologies, because that technology that you've developed is going to give somebody information. That information will determine whether they seek care or they don't seek care. So there's so much we can do as service providers. We develop innovative models, we drive demand creation, we offer products as professionals, but for it to be sustainable, we need to ask ourselves, how do we engage, how do we plug in the different facets, and how do we make it be structured? Because one of the key things that we've also noted in terms of engagements, including in the SRHR Youth Champions Network, is that we are working to improve access to menstrual hygiene products, access to contraceptives, and all these as they move forward, the gap has been we are not structuring them to be sustainable in the long term. And if they're not sustainable, then it means this year we provided sanitary towels. What makes it be sustainable? How do these needy young girls in school get their next supply of sanitary towels? If it's not structured, it's not going to fail. So how do we make these sustainable? How do we come up with solutions? And on these, I know we have some of our speakers who will be presenting their case studies on what can be done and how it can be made sustainable. So we urge you to join us. Let's engage, let's develop solutions together. 1st to 3rd of December, Amref International University is the location. Come on, let's engage and let's make this a reality. Thank you.